It's been a couple of years since we've talked about Medicare, and there have been some changes, so we're certainly going to address that, but we're going to make sure that people who are approaching the age of 65 have a better understanding of what they need to do or not do, because there are different approaches based on if you're working or if you're not working. So it will certainly be an introduction to Medicare for many of you, some because you're getting close to 65. If you decide to continue to work, you'll still be eligible for your Medicare, but you'll just be looking at it a little differently. So we're going to address all of that. So the name is Nancy Corser. I have been helping people with their Medicare, trying to make it simple, although it's not very simple, for about 18 years now. And Amy is part of my team. It has grown, the team, as well as our ability to help other people. And today we're going to be guiding you. And as we said, we are going to record this presentation, so feel free to take another look at it. We also have a website, nancycorser.com. You can certainly learn more about Medicare as well. But we do want to be a resource for you. Here at Cornerstone Retirement Partners, we do connect the health and the wealth. So what we mean by that is we do have two financial advisors. So should you have any questions about IRAs or 401ks or 403bs, we're certainly here to help with that. But it had become very apparent that people said how nice it is to be able to come to the one-stop shop, help us with our finances, help us with our health insurance, so on and so forth. So we do that. And we are located in Grand Rapids, Michigan. We will meet you virtually anywhere you need to be, certainly via Zoom. And we also have in-house seminars and do telephone appointments and so on and so forth. So we're here to help you. This is an educational seminar. We are not going to talk about any particular products or any particular companies. A little bit more about me. I am an independent agent, as is Amy, and we also have Kristen. All three of us have different carriers that we represent. We think it's very important that you have choices so that it's not one particular carrier. We can show you options. We can show you other insurance companies, and we can do comparisons together. We are very relationship oriented. We still meet people one-on-one. Some organizations are strictly over the phone or they'll do Zoom. We will do it your way, but vast majority of people that we meet with, they're coming into our Grand Rapids office. And it's generally 2 appointments. The first appointment is just kind of getting to know each other, starting to get an understanding of A, B, C, and D, because that's what we're going to do today, as well as help them sometimes sign up for their Medicare and then talk about their supplemental insurance, because Medicare doesn't pay for everything. Surprise, surprise. And as I mentioned, we do connect the health and the wealth here at Cornerstone Retirement Partners. And there are a number of us. Here's the team. So you can see that there's 4 of us, and we specialize in the health insurance arena. So not only do we help with Medicare, although that's what we're talking about today, if you are under age 65 and you do need help with your health insurance, we will also help with that by way of the marketplace, sometimes called Obamacare. So what we don't do is we don't write group insurance. And most of you all that are working, you're on a group plan with Priority Health. I don't do that type of business. I do strictly individual business. But we help if you're under 65 and you're no longer working, or you don't have access to health insurance, or if you're approaching the age of 65, that's when we would be more than happy to help you. So I jumped the gun here a minute. On the very far left, which I think is still your left, is Becca. She is a recent college graduate. She's the newest member of our team, and she's kind of our back office support. In the middle there is Kristen, and she also does the same type of thing as Amy, which they are both licensed advisors helping people just like I've been doing for the 18 years. And I'm the one there in the middle with the glasses and the graying hair. All right, so we're wondering if you were sitting in the room with us and we could see you, would anyone look like this? Oh my gosh, what am I going to do about my Medicare planning? And let me tell you, when you start to approach 65, they've got your name and number, and they are sending you oodles of stuff in the mail. And you're also getting phone calls. And be very cautious about answering that phone or even requesting information online, because if you do it, they have your name and number and they will not leave you alone. So be very, very cautious about what kind of information you share or even request. So the guidance today is to try to help you make Medicare simple. We're going to keep it fairly high level. We would offer you an appointment if you're getting close to turning 65 and you want to begin the conversation. And that's not uncommon. We'll get people 6 months, 8 months in advance that will say, I want to start to better understand this. I want to map it out. But most importantly, I want to tell you about my specific situation so that you can help me. So today, again, keeping it a little bit more high level and not too customized. So here's the agenda for today. We're going to talk about Medicare. How did it come about? How long has it been available to us? The enrollment itself, how you go about doing that. It's had basically these 4 parts for many years: Part A, Part B, Part C, and Part D. And if any of you have helped your parents with their Medicare, some of these letters are somewhat familiar to you because, again, they've been around actually since 1965. Every year, Medicare costs and coverage do change. So we're going to be talking about 2023. We're not going to get too far into the weeds, but you'll have a little better understanding of the fact that you will pay a premium, and there is some deductible co-insurance and co-pays that are required of you. Probably within the next month, we will have the 2024 cost information, and it will be announced by Medicare. The supplemental options are important to begin to understand. Again, not going to go into specific names of companies and that type of thing, because there's a whole lot of them that participate in this space. But this is really, think of this as add-on insurance, because Medicare doesn't pay for everything. Most people want to buy additional insurance, otherwise known as supplemental, so that they can bridge the gap of what's out there for original Medicare. We're going to talk about the prescription drug plan and then leave it at the end, any type of question and answer. And again, as we said, if there's something a little confusing along the way and you feel the need to help others, because that's what you'll do, please just chat. We'll stop, answer the question, and go on. So what is Medicare? Medicare is the National Health Insurance Program put together by the U.S. government. It was introduced in 1965 as part of the Great Society. In the Great Society, the president was Lyndon Baines Johnson. And at that time, many people had access to group health plans and pensions. But as people started to retire and the economy started to change, and we had the Great Depression, the government said, we need to make sure that people, when they retire, if they don't have retiree insurance, which is few and far between, they have something to fall back on. So Medicare is its own animal, if you will. It is very unlike the group insurance that you have today. And I would say overall, they do a pretty good job of covering the major stuff. And we'll talk more about that in detail. But overall, most people are pretty happy to move to Medicare. And when they see the coverage that's offered, they're pretty pleased. And again, this is not to be confused with Medicaid. So Medicare is when you're first eligible at age 65, or when you're no longer working and now you need your Medicare after age 65. Medicaid is a government program for those people with a lesser income, and they have helped them with a health insurance program called Medicaid, but this is Medicare. So the folks that are eligible, it's anybody that's over the age of 65. They are a U.S. citizen, and they are a legal resident who has lived in the United States continuously for at least 5 years. There are some people who are under age 65 who have qualified for Medicare due to a disability. And those people actually become eligible 25 months after they have been approved for their disability. So we will have people who will come to us. They might be 50, 55, 60, but they're not 65 yet, and they will have their Medicare card that they've received in the mail. There are also a group of folks that have end-stage renal disease, and they also become eligible for Medicare prior to age 65. So those would be the conditions upon coming aboard. Medicare is big into enrollment periods, and you will often hear these and see these acronyms. So here we go. The first is, when you become eligible at age 65, you are entitled to your initial enrollment period. The acronym is IEP. We're going to talk about that in a minute in more detail. Next enrollment period, SEP, stands for a special enrollment period. So you only get one IEP, which could be we're still working and now you're age 67 and you've decided I'm going to call it quits. You're going to turn in your resignation and now you need your Medicare. Now you're going to be eligible for an SEP. So the point is, with a special enrollment period and the proper documentation, you will not have any kind of penalty for not enrolling when you turn 65. Next enrollment period, AEP, annual election period or annual enrollment period. This is what Amy and I are gearing up for. It will start on October the 15th. There'll be a ton of advertisements on TV. We're already starting to see them, and they are encouraging people that already have existing Medicare. They're reminding them to revisit their plans. And in the event they want to make a change, either they call an agent like myself or an advisor, or again, the word of caution is if you dial those 1-800 numbers, what you find is that they're not in the know about Western Michigan. So they could be located in a call center anywhere, and they're really not going to be able to tell you much about the plans that you really need to know about. But the point is this, between October 15 and December 7 is a period of time people can make changes if they are already in Medicare. And those changes then are effective on January 1st. Two more enrollment periods. The first one is called a general enrollment period. We don't get too involved in these, but what this means is that the person missed their IEP, they missed their SEP, and now they still need their Medicare, and they're like, oh my word, what am I going to do now? So the government has said, we're going to give you one more shot here, and depending upon when you exercise it, you will have a penalty for not enrolling initially when you should have, or with a special election period. And they have a period of time. It actually has recently changed, but in essence, I had someone this morning and he didn't know what he needed to do. He missed it. He missed the IEP, he missed the SEP. So what he will do is he will enroll in January and he will get a February effective date. He will also get a 10% penalty, and the penalty will be 10% of his Part B premium. And you'll see that in a moment what that's going to look like. For him, it's going to look like 16 or 17 extra dollars per month that he's going to pay. The last one is called the open enrollment period. It is something we can't advertise, but it is one more time that if a person has an Advantage plan, and we might have people on this call or spouses that have an Advantage plan, the government has made a provision. Again, I can't advertise it, but it will be advertised by the government. It will be on TV, and it's encouraging people that have an Advantage plan to perhaps take one more look at, do they want to stay in the existing plan or do they want to make a move? And again, when they make a move here between January and March, it's always effective the first of the following month. So the last day they could make a change would be 3/31, and it would be effective on April 1st. The Medicare enrollment. So the long and short basically is this. If you are already collecting Social Security, you will automatically be enrolled in Medicare. If you are continuing to work and you decide, I don't need my Medicare Part A and B, we're going to talk about that in more detail, you would actually be returning your card because you're going to find that Part B has a premium. And your employer, Kent District Library, says you can stay on the group plan. There are 20 or more employees, and you don't need to pay for Part B, okay? So the point here is if you're collecting Social Security, you're still working, you have group health insurance, you may not need to keep Part B. So you could certainly call us and walk us through that, but I wouldn't want you to be surprised and thinking, oh, I have to keep Part B, when maybe you don't have to. And every once in a while, we will run into that. Somebody will say, I didn't know I didn't have to pay for this. So we certainly don't want that to happen if you are still working, but you're collecting Social Security. So the way that it works is you actually receive your card 3 months in advance. They're very good at getting it in the mail to you. Comes in a white or a brown envelope. It looks a little bit like junk mail, so you want to make sure you don't throw it away. And as I mentioned previously, it's possible if you're still working that you're not going to keep Part B, but they will not take back Part A. And we'll talk a little bit about that in a moment. The comment at the bottom of the page, HSA contributions prohibited. So what they're telling you is if you have any part of Medicare, either A or A and B, you must stop contributing to an HSA account. So that stands for health savings account. Your employer might be participating in that. You would certainly, and you would be on a high deductible type of plan. Okay. Again, if you have any questions about that, do let us know. But the point here is keep in mind, if you're on any part of Medicare, you must no longer contribute. So those people that are not collecting Social Security, they have to decide whether or not they want their Medicare. So again, if there are 20 or more employees, you may not need to do anything at all. But if you decide that Medicare is the better choice for you, and maybe it's because you're no longer working, and part of what we will do for you is we will sit with you and we will help you compare what would be the cost if I came aboard Medicare versus if I stay on my group plan. That is something that we will help you with that determination. But if you got through all of that and said, you know what, I know I need to take my Medicare, the enrollment would actually be done best online. So we highly recommend that you set up an account on socialsecurity.gov. It's a fairly straightforward website. There are 3 ways to log in. The first way of logging in says the person has already set up a Social Security account back in 2021. Then there's another way to set up an account if you're brand new. In fact, there's actually 2 ways. When you set up your Social Security account, not only can you see your Social Security benefits, it's also your opportunity to enroll in Medicare. So when we think of Medicare and Social Security, they work very closely together. Medicare is your government health benefit. Social Security is your retirement benefit. So that's your income, if you will, or the retirement benefit. But Social Security works closely with Medicare in that they do the enrollment on behalf of the Medicare recipient and they collect the premium. So if this is you, you are actually going to be enrolling 3 months prior on the Social Security website. We do help people with this. If you decide, nope, I am not quitting, I don't want my health insurance, I love the health insurance I have with Priority Health, then you certainly do not want to do anything, especially if you have an HSA. So again, I know there's a lot of information here. We will have people sometimes come and say, I am working, but you know what? Part A doesn't cost anything, and I'm not on an HSA. Do you think it would be a good idea for me to get set up and get my Medicare Part A since it's not costing me anything? And we do think that's a good idea. It does make it easier for when it's time to sign up for Part B. But I want you to know, if you don't do either one and you're still working, that's perfectly fine, because we can help you eventually sign up with A and B when you need it. A lot of moving parts here. Here's that initial enrollment period. All I want you to know here is if you're not collecting Social Security, I had someone this morning, her birth date is January. The earliest she can enroll is in October. That would be the 3 months prior to her birth date. If your birth date, for example, let's say is January 15, they're always going to enroll you the first of your birth month, unless you were born on the 1st. So yesterday I had somebody born on December 1. her Medicare will start on November 1. So they will automatically give her the 30 days prior. But in the case of the person this morning, she can get online into her Social Security account. She can enroll in her Medicare beginning in October. She could do it in November, and she could even do it in December. The earliest she would get a date for Medicare would be January 1st. Now, the sooner you sign up for it, the sooner you're going to get your card. So we recommend that you try to do it 3 months before, but they do give you a 90-day window to make it all happen. If for some reason you either forget or from a timing perspective, it makes sense to enroll in the 3 months after your birth month. And sometimes people will say, I don't need it to start January 1st. They might say, I need it to start February 1st. Then they would literally enroll online in the month of January, and the government automatically gives them the next month. So we can walk you through that if for some reason you would say, wait a minute, I don't need January 1st. I need a different date. We can back into it and we can guide you there. Here are the Medicare cards. They certainly have changed over the last 5 or 6 years. On the far left is the old card. So you can see it's still red, white, and blue. We had the person's name, but they used to use their Social Security number. That actually made my job a bit easier when it was time to do the enrollment for the supplement. Now we actually have a Medicare ID number on the right-hand side, and it's an alphanumeric number. It's uniquely assigned to you. It will never change, and you will have it to your last day. We still have Part A and B. We still have dates as I have described. If a person comes aboard with Part A and Part B at the same time, they will have the same date. If somebody continues to work, they will most likely have 2 different dates. They will have a Part A date, that's one date, and they will have a Part B date. That is the date that they want their health insurance to start, and they know that they are now starting to pay for it. Because remember, Part A costs you nothing, but Part B has a premium that you'll pay. And no longer is there a signature, and no longer is there a male-female date. That's your card. It is paper. We will laminate it for you. If you ever lose it or you wash it in the wash machine, they will replace it. Who's they? It's going to be Medicare that would replace your card. Here's a general rule of thumb. We kind of spoke to it a little bit. You are all on a group plan through your employer that has 20 or more employees. So you can decide to stay with your employer group or not. That's always your option when you turn 65. And the same holds true for your spouse, okay? So if you're married, the same rule applies, okay? Some of you are on your spouse's plan or your spouse is on your plan. The coverage is based on whether or not you have access to a group plan with 20 or more employees and are still working. So the key is if you're still working, you probably don't have to do anything. You could sign up for Part A, but again, it's when you don't have an HSA account. So let's talk about the costs and coverage. Again, this is related to 2023. So Part A, as I mentioned, a person has worked 10 years or more. If you have a spouse who has never worked, but you are married, they are eligible for Medicare, just so that you know that, okay? So Part A, no premium. It is the hospitalization portion of Medicare. There are a lot of out-of-pocket costs in the form of deductibles and copays. The biggest one is the first day you show up at the hospital and they put you in as an inpatient, you will owe the government $1,600. This begins to point out why people buy additional or supplemental insurance to bridge that gap of that $1,600 hospital bill. When you're in the hospital, think of it as an umbrella, and everything is covered under the $1,600. Your room and board, your doctors, your surgery, your physical therapy, your blood work, whatever you can think of, as long as you are an admitted patient. And it's based on a 60-day window, that $1,600 figure. Part B is what everybody pays for. People on Medicaid do not, but people on Medicare, this is the base premium. This is the lowest premium. Regardless of how much money you make or not make, This is where everybody starts. This year it's $164.90. We've heard that it will go up about $10 next year. So I figure right now I'm estimating $175 for people that come aboard in 2024. Part B in general, and you've often heard this, Part B pays 80% and you pay 20%. So if you went to the doctor and he was a specialist and the bill was $300, you would pay $60. Part B medical services include anything outside the hospital. So you're not an admitted patient. So now the doc says, okay, you're out of the hospital, you need physical therapy. That is a Part B medical service. You need blood work. That's a Part B medical service. You take a ride in the ambulance, Part B medical service. You walk into the emergency room, but they said, you know what? You're not having a heart attack. You can go home. That's a Part B medical service. If you had been admitted, it would have been a Part A medical service. So in general, Part B is Medicare pays 80. You're going to pay 20% of the approved amount. Now remember, when you move into the Medicare ranks, you have to make sure that your doctors take Medicare. And in a moment, we're going to talk about a supplemental option. And then you need to make sure your doctors participate in a network, which isn't unlike what you have today. Some of you might have an HMO, some of you might have a PPO, and you always have to be cognizant of the fact that I'm working within a network. Because if you go outside the network, generally it's going to cost more. So those of you that might have an income that exceeds the base. So what I mean by that is if anybody's on the call that is an individual, you're a single person, and you're getting ready to join the ranks of Medicare, let's pretend it's this year because I have numbers for that. They're going to look at your 2021 income tax. And if your income is less than $97,000, it will be $164.90. If it's above that, without going into all the different levels, just know that there's 4 or 5 additional tiers, and it's all based on your income. So if we've got somebody on the call here that's really making some big bucks, I'll just show another number here. And let's say somebody says, wow, I'm making 150 grand. Maybe Kent District Library pays that much. I doubt it. But if somebody was making $150,000, okay, and they were a single person, they wouldn't pay $164.90. They would actually pay $428.60. And they would also have to add their Part D as a higher income beneficiary. So really the takeaway here is this. If you're a single person and your income's less than $97,000 for your 2021 income tax, and if you're married and your income tax as joint filed is less than $194,000, you will also be paying the $164.90. So feel free to ask us any questions. Again, it's going to pertain specifically to your income and where you fall. This is your modified adjusted gross income. So you can look at your income tax, you can call your tax accountant and say, okay, exactly where am I here? So I will just simply say this. If some of you are maybe in your 50s or even in your early 60s, it does pay to talk to a financial advisor if you have one and say, look, I heard about this higher income Part B. If I'm there, are there things that you as an advisor can help me reduce my income? Because there are strategies that a financial advisor can employ to try to help you reduce your income. So if you fall at the first tier, there's nothing you can do. But if you fall at a higher tier, there may be some steps that you might be able to take. Otherwise, know that the premiums are adjusted annually. So some people have sold property and they said, are you kidding? I've got to include those proceeds into my income? And the answer is yes. So they could have a year where they pay more, but the government every year is going to reevaluate it. And then come January 1st of the upcoming year, they're going to look at the income tax, not of 2021, but of 2022. So know that they always will look back 2 years. And last but not least, once in a while, somebody will say, but wait a minute, my circumstances are entirely different. I'm getting a divorce. I did quit my job and I don't make that kind of money. The government is open to a redetermination. And they got a whole bunch of forms and they are actually willing to revisit what they might have tagged you with, and people have been very successful and initially started out paying $400 and they went back to the government and said, wait a minute, I have a life-changing event here, and they've been successful in being able to bring their premium down. So again, this is something that you need to know about. A lot of people don't know this. Okay, a little bit more information here. Part A, remember that's your hospital insurance. Part B is your medical insurance. We're going to talk about Part C. That is called a Medicare Advantage plan. And then we're also going to talk about Part D. That's your prescription drug plan. So anything that has the name Part is overseen by the federal government, Medicare and Medicaid. That's the government having put together plans that say this is how it has to work. Everybody has to be in Part A and B to even look at getting Part C. You'll see that in a moment. And if somebody actually has Part A, they have to consider getting Part D, okay? And we'll go through that in a moment. But these are the parts of Medicare. If you come into the office at some point, this diagram is everywhere in our office because we talk about the left side and we talk about the right side of the diagram. Everybody must have Part A and B to go a step further. So if you're no longer working, you need your Medicare, here we are. You're going to be seeing this diagram. And on the left-hand side, I will tell you that you have original Medicare. You have decided to add something called a supplement, otherwise known as a Medicare supplement or a Medigap. We're going to talk in more detail about each one, but this person has 3 cards in their wallet. They have an A and B, that's a red, white, and blue card. They have a Medigap supplement with a carrier whose name could be United Healthcare, Priority Health, Blue Cross Blue Shield. The list goes on and on. And they would also add a prescription drug plan. So when I mentioned the annual election period, for these people on the left side, they will be coming to see us about their Part D. The Part D is renewable on an annual basis. Plan premiums will change and the formularies will change. So we always recommend not leaving them in autopilot because things do change. But this person on the left-hand side has 3 cards. They're going to pay a little more than the guy on the right-hand side, but the coverage is going to be very different. So we'll go through that. On the right-hand side, very popular, Medicare Advantage plan. In the years that I've been doing this, more and more people are moving to the Medicare Advantage plan. The networks are becoming much more expansive, including doctors, whereas before they were more limited. They have a lot of bells and whistles, and it actually is more like a group plan in that you pay as you go. On the left-hand side, you're going to pay more in a premium for that supplemental coverage at the bottom, whereas on the right-hand side, you might actually start out with a 0 premium. So, to continue, the Medigap policy. The Medigap policy is a private insurance company policy. The plans are standardized. So the most popular plan for people coming aboard today is plan letter G, not to be confused with a part, although there's not a Part G. But remember, when we talk about Medigaps, we're talking about a plan. When we talk about Medicare, we're talking about a part. So the most popular letter, plan G, what you need to walk away knowing is that no matter what carrier you go with, they will all pay the same way. But what isn't the same is the premium. So we help people in determining the best premium. And they do range anywhere from one company might have a premium of $100 and another company who does the very same thing pays the claim the very same way. According to the guidelines of the government, it could be $30 more a month. So I want you to know that. Next, Medigap policy. Depending upon the plan, you might have virtually no co-pays, no co-insurance, no deductibles. So that's why we told you a little bit about original Medicare. The purpose of the Medigap is you're willing to pay more in a premium because you want to avoid the co-pays. Certainly the downside is if you pay $100 a month in a premium and you're age 65 and you don't use the plan, you have to be okay paying the premium to the Medigap company versus the Advantage plan, which is paying as you go. So think of this one as paying up front. You get peace of mind and knowing that you've got complete coverage with a little bit of out of pocket, and that's for Plan G. No health screening questions when you're first eligible. So I'll have people come in and they're like, Nance, I'm being treated for cancer. I have a COPD diagnosis. They're on oxygen. They come in with a wheelchair or a walker, and they're telling me they're seeing the doctors on a regular basis, hospitals, so on and so forth. I really believe that that person needs to take a good look at the Medigap, because they will avoid all those little copays and out of pockets that eventually are going to add up. Also, this person or these people can see any doctor or provider that takes Medicare. They are not in a network. So as long as the doctor takes Medicare, they have the flexibility of going to any physician, any hospital, any specialist, so on and so forth. The only question is, do you take Medicare? They also have coverage throughout the United States. So it's a policy that people who travel, they love something like this because it's very easy to administer. As long as the doctor will take you as a new patient, you're good to go. Now we're going to switch Medicare Advantage plan. So now I'm on the right-hand side of the diagram. This is what we're getting ready to review. We don't even know a lot of the information yet, because although we've done our recertifications required every year, the carriers don't tell us what ultimately all the premiums will be. But what I can tell you is, like last year, there were a ton of zero premiums. So what I mean by that is you still are paying your $164.90, your Part B premium, or the $175 or whatever it's going to be coming up. But the bottom line on this one is there literally is no premium. So you have to have A and B. You tack on a Medicare Advantage plan. They are going to manage your care. They've been around for probably a good 10 or 12 years. Think of it as one-stop shopping. What is a little tricky is you might have Priority Health who has a Medigap, but they also have an Advantage plan. You might have Blue Cross that has a Medigap, but they also have a Medicare Advantage plan. So when someone says to you, well, I pay nothing in a premium, what you really want to ask them is, what do you pay to go to the hospital? Because if they tell you they pay $0 to go to the hospital, you know they have a Medigap. But if they say, oh, I think I pay $300 every day I'm there, and my maximum number of days is 5, you know they have an Advantage plan. So what that Advantage plan did is it took the $1,600 charge that you otherwise would have paid on original Medicare for Part A, and it parsed it. It said, not going to charge you 16, but we are going to have a per day charge for however many days you're there. The beauty of the Advantage plan is it's one card. So you're not shuffling around with 3. A lot of people will put their Medicare card away because you're using the one-stop shopping card. There are benefits and cost sharings that vary from plan to plan. That's why, again, during open enrollment, sometimes people will shop and they'll say, I have this carrier, but I'd like to look at that carrier. And then we will do that. That's part of what we do during open enrollment. It's the busiest time of the year. We're a lot like a CPA, and we're going crazy for about 10 weeks straight. The beauty of these plans in terms of a safeguard is if you ever spent approximately $5,000 of your own money, they're going to keep track of that, and that's called your maximum out of pocket. So you probably have a maximum on your plan today. On average, these run about $5,000. So they're going to keep track of all your out-of-pocket expense. They are not going to include your out-of-pocket expense for your medications. The medications are outside of their calculation for the maximum out-of-pocket. And they will let you know either on a monthly or a quarterly basis exactly where you stand. Now, statistically, very, very few people ever hit the maximum out of pocket, just to let you know. But it is there as a catastrophic level. Also, keep in mind there is no deductible on an Advantage plan to get started. So on a group plan, you often have to satisfy a deductible, and then the copays come into play. That is not true here for the Advantage plan. So when you're good to go, most of the plans that have a 0 premium, They have a no cost to go see the primary care doctor. And then from there, the copays will kick in. So if you went to the specialist, you might pay 35 to 45, and then the list kind of goes from there. But most of the zero premium plans, primary care doctors are zero. To continue, Medicare Advantage plan. Right now, I would say that of the clients that we have, probably close to 60% have a Medicare Advantage plan. We had 45 people last year who went from the Medigap plan to the Medicare Advantage plan. One of the big differences in why they can do that is keep in mind that the Medicare Advantage plan never requires any medical underwriting. So when I told you about that Medigap on the left-hand side, if your health is of concern, and we do know that our health will change over the time and over the years, you might be better off starting with a Medigap, knowing that you can always go to a Medicare Advantage plan because they'll never ask you any questions. So we had 45 people last year. That's exactly what they did. And so far, so good. They also get what's called a trial right. So if somebody decides they want to try that, the government does give them a 12-month window with which to try. But the key to remember here is that when you have a Medicare Advantage plan, we have to know that the doctors, hospitals, labs, so on and so forth, that they all participate with the specific plan. And just so you know, Priority Health's the big dog. Then we've got Blue Cross Blue Shield. Coming behind that is probably Humana, and then Aetna, maybe HAP, WellCare. There are probably 10 or 12 different Medicare Advantage plan carriers, and each of them have probably anywhere between 5 to 10 individual plans. So there's a lot to try to decipher, and that's why a lot of people want help. We've got tools behind the scenes that we can plug into, and then we'll work on it together as far as what's the best plan for you. Keep in mind on the Advantage plan, emergency and urgent care coverage anywhere in the world. So if you had a fracture and you fell off a curb in Paris, France, you can go to the hospital in Paris, France. If you go to the hospital and they say it's really not broken, but it's badly sprained, let's wrap it up for you. You just spent $110. That same $110 would apply here in Grand Rapids, Michigan. Again, we would go through that with you, but urgent and emergency care, no matter where you are, is at the same copay that would be in Western Michigan if it happened here. The beauty of these plans are they do have the extras, whereas on the left-hand side, they don't. We have plans for those. But otherwise, if you go with an Advantage plan, you're going to find that it's built in or embedded, and you're going to have preventative dental, vision, hearing. Most all of them have a health club membership. The name of it is Silver Sneakers. I'm sure some of you have heard of that. And Silver Sneakers is available nationwide. So if you travel and you're here in Michigan, but now you go to Florida, you can go to a Silver Sneakers facility there. And they also have over-the-counter benefits. So these are not medications, but they are medically related. So I need vitamins, I need aspirin, I need Pepto-Bismol, whatever the case may be. The beauty of these plans is that you can renew them yearly. The plans do change, not significantly, but somewhat. And many of our clients, they review the annual notice of change, which is being sent as we speak, and we never even hear from them. They take a look at it and they go, you know what, my zero is going to be zero next year. I took a look at the changes and I'm perfectly fine with them, and it automatically renews. So that's what you need to know. Moving along with the next plan letter D, and plan letter D stands for the prescription drug coverage. It was introduced in 2006. It has to be paired with a Medigap plan. Medigap does not include prescription drug coverage. We saw that it's embedded in a Medicare Advantage plan. You don't pay extra for it. Every plan that represents the Part D, the government says you must have formularies that account for any and all types of medical conditions. So you may think, oh, all I have is high blood pressure. Here's my med. Next week, you find out, ooh, I need a cholesterol medication, et cetera, et cetera. The formularies are designed where they have to meet all of those medical needs, no matter what they are. You got vertigo, you have cancer, you have this, you have that. So don't be afraid that you're going to pick a plan that your medication isn't on, because the government's very clear that you have to be able to pick and have choice of all the medical needs that have to be met with your medications. The other thing is there are preferred and standard pharmacies. Preferred pharmacies are those which you will get the better value, and they are negotiated by the Advantage plan. Premiums, most of them are zero, but there are plans that do have premiums. Generally speaking, if you have a premium on your Advantage plan, you will have a lower maximum out of pocket, and you'll probably have some lower copays and perhaps some annual deductibles. Again, the Part D prescription drug coverage, when it's a standalone, is renewable every year. Otherwise, it gets renewed along with the Part C, because D is included in the Part C plan. Again, I mentioned the formulary and how that works. Your medications will be assigned a tier. What we'll ask from you, if you want us to help you, is a list of those medications, so that we can ascertain the tier that that medication will be. Generally speaking, tier 1 and 2 are generic, tier 3 and 4 are brand, and tier 5 is a specialty tier. As the tiers increase in number, you're going to pay more in terms of a copay or a co-insurance. I've already mentioned preferred pharmacies. A lot of times, mom and pop pharmacies are either not covered or they are standard pharmacies. So it's always important to know, am I going to a preferred pharmacy with my plan, or am I going to a standard pharmacy? And many plans offer mail order, and sometimes there is a reduction in what you will pay. A lot of Advantage plan mail orders will actually give you a zero copay if you have a tier 1 or a tier 1 and a tier 2. These are, again, things that we'll walk through with you. Not going to spend a lot on this, but there is something that is referred to as a donut hole. So back in 2006, the government said, we're going to have this really crazy diagram that when you go to the pharmacy or you do mail order, it's going to go through these different levels of coverage. So the very first stage, or level number 1, says it's a deductible. It could be $505, but it actually depends on whether or not you have tier 1, 2, 3, or 4. Again, that's where we're going to come into play. Hypothetically, you could be eligible for the $505, and it would be the first payment you would make, and it would be the retail value of the drug. So many of you know, if you take an expensive drug, Eliquis is a good example. It's a blood thinner. The retail price of Eliquis is probably in the neighborhood of $400. If somebody had a plan where they were subject to the $505, the first payment they're going to make is $400 for that Eliquis for that 30 days. Stage 2, along the way, the government, the pharmacy, is keeping track of all the medications that you purchase. And in the event you spend $4,660 in retail price, so let's take Eliquis. So I have $400. I got to fill it every month. How long will it take me to get to $4,660? It's going to take a little over 10 months, right? So in the 10th or the 11th month, I'm going to pay more. So not only did I start with $505, stage 2 actually is probably a copay. I'm going to tell you that maybe it's $42. And then all of a sudden you're like, oh my gosh, now what? Well, they were keeping track of the retail price, and now you ended up in the coverage gap, otherwise known as the donut hole. And at that point, you're going to pay 25% of the cost of Eliquis. So now, instead of paying $42, you're going to pay $100, okay? So again, if anybody has really expensive medications, and you pretty much know if you're paying higher copays, know that behind the scenes, you're going to have a retail price. Often it's on the outside of the bag. When you come into the Medicare arena, we're going to have to evaluate that so that you can see, where am I going to be? Am I just going to end up in stage 2? And is that where I'm going to stay? Or am I going to move myself through the various stages? Last but not least is stage 4. It's called the catastrophic level. That's when a person spends $7,400. They're keeping track of that retail price Eliquis. They're adding some other factors to it. And they're going to tell you that now you're in the catastrophic phase, at which point you're going to pay $4.15 for the generic, but you're going to pay $10.35 for the Eliquis. So Eliquis, you start out with 505, you paid 400. Now I pay 42. This is only an example. Before you know it, stage 3 is kicked in. Now I'm going to pay $100. And if you have a whole lot of drugs, they all go into the mix, and you could actually end up in the catastrophic level, which actually would be less expensive than the coverage gap. Okay, but look at all the money you had to spend to get there. So again, these are things we're working on. The other thing you should know is the government has made some pretty significant inroads. It used to be that the government could not negotiate with the pharmaceutical companies, and they have gone back and they have put in legislation that has said, we are going to negotiate with the drug companies and they are going to work with us. So they are going to be making some substantial changes to the coverage gap and the catastrophic level. I'll eventually have another seminar on this if you're interested, or again, this is something we can talk through. But as far as the year 2024, I can tell you that the companies are going to be negotiating with the government, and they're going to be set aside 10 of the highest cost, widely used medications in an effort to get the drugs down. And then you're going to start to see some more changes. The government also said that for stage 3 in the year 2025, so we got a couple years to go, you will never spend more than $2,000 out of pocket for all of your medications. So they're going to try to help us. Part D, it used to be, just a little history here, that when somebody came aboard in 2006, literally they paid 100% when they were in the donut hole. So in the example of the Eliquis, and I had this because I've been doing it a long time, people literally paid the $400 for Eliquis. It hasn't been around since 2006, but imagine finding yourself in the donut hole. You paid $42, but now instead of paying 25% or $100, which is where we are at in 2020, it leveled out, those people paid $400. The good news is this resets every year. It's a 12-month type of accumulation. Here are some other cost reduction ideas, and again, we'll help you with that. There are some foundations that will help with people who have real significant issues, maybe rheumatoid arthritis, the list goes on. Name of it is Good Days, and they do help people with some chronic diseases. They've got a special fund set aside. Meyer has offered some free antibiotics. Somebody was telling me that that was changing. Same thing with metformin and atorvastatin, which is your Lipitor. I got a hunch that they now have a price tag on it, and I have yet to kind of check it out. But I've also heard that Walmart has some medications that cost you nothing as well. So it definitely pays to shop around. Then we have some Canadian pharmacies. I have people that will shop. And in the past, insulin, they paid big bucks for their insulin. The government has said it won't cost you more than $35. That is already in play. But there are people that will go out to the Canadian market in an effort to reduce their overall cost, and then they can avoid going through that diagram because they're not buying it through their drug plan. They're going to a different pharmacy. They have to have a prescription, but it doesn't count towards the doggone donut hole. Okay, kind of coming in a little bit for a landing and any other questions that we might have. What you need to know is that Medicare doesn't cover everything, but they do a good job. Here's what they don't cover. So for long-term care is anything that constitutes 100 days or more. So if you went to the hospital and then they said you can't go home, they're going to put you in skilled nursing. You're going to have some out-of-pocket expense, but after day 100, it's all private pay. So we do help with long-term care insurance if that's anything you want any kind of quote on and you want to talk more about. Care outside of the United States. Well, the good news is the Advantage plan and the Medigap plan, they both have additional coverage outside the United States. But when we use the word traditional, Medicare A and B doesn't offer coverage outside the United States. So if all you kept was a red, white, and blue card and you traveled to Mexico or Canada, you don't have coverage. Dental, vision, and hearing is not a preventative service offered by traditional Medicare. I think it should be, but it isn't. So the Advantage plan came to the party and they said, we're going to offer dental, vision, and hearing. And again, if you're on the left-hand side, we do have separate plans. Unfortunately, there is another premium to pay. Cosmetic surgery. Nope, we don't get to get facelifts or try to look pretty as we get older. They do eyelid surgery, though. It has to come from the doctor. But if you have droopy eyelids, that is a covered benefit by Medicare. They also have started to offer a little bit of acupuncture, and any amounts that are over the Medicare approved amount also might become your responsibility. So that's why it's always important to know your doctor takes Medicare and that he accepts the terms and conditions of Medicare. Important information to know. Recently, the Shingrix shot, there's a new one for shingles. It is now a covered vaccine, so you're not paying anything for it. In the past, people did. Also know that if you ever had cancer or if you have arthritis where you might need to go in for an infusion, the infusion or the injectable type of drugs delivered in a center like a Lemon Holton or the Mercy Health system, that would actually go through your Part B as in baby, not your Part D. So that is the exception, that Part B does have some medications that will be priced through the Part B component of your plan. If you do have a Medigap plan today, or you know someone that does, please let them know they can revisit it anytime. It's not subject to open enrollment like we're coming up. They can say, you know what, I think I can qualify for a new plan. Now they don't get the freebie. Now they have to answer the medical questions the next go round, and we help with that. And again, if you come aboard with any portion of Medicare and have an HSA, you must stop contributing. COVID-19, we think the lab tests are still covered. I know they've made some changes recently on that because we're far enough away from the 2020. Telehealth is a big deal, especially as a result of COVID and having to work online. Most all the plans have some type of telehealth connection. Most of it is no cost to you. Insulin, if anybody has specific insulin needs, many of the insulins, not the new ones that are pills, unfortunately, but the ones where you got the vials or you have the pre-filled syringes, most of those are going to be $35 copay every month. But if you're taking Jardiance and some of the other pills, those are not covered at $35. Again, those are things we help with. So tools and resources, certainly we're one of them. Otherwise, we encourage you to go out to Medicare.gov. That's where it's going to talk all about Medicare, what's approved in terms of medical services. Social Security.gov or SSA.gov is where you would enroll in Medicare Part A and B, or certainly let us know and we can help you. We have contacts at Social Security. If we have any unique questions, we will inquire of them. There's also a website called mymedicare.gov. You have to actually have Part A and B to use the mymedicare.gov, but it keeps track of all of your claims and preventative services and when they need to be done, and they know what carriers you have for your supplemental and so on. There's a new book every year published called Medicare and You. It's coming out this month. I haven't seen mine yet. I am on Medicare. The next one is called Choosing a Medigap Policy. It is a book similar to the one above, and it just talks about all the terms and conditions and how it all works and so on and so forth. Carrier websites might also be another way to learn more. Go to Priority Health, go to Blue Cross, and you can look around and start to do some more reading. Again, we do have a website, nancycourser.com. We also have a host of information about Medicare. Talk to friends, talk to relatives. Again, when they say they don't pay anything, make sure you ask them, if you go to the hospital, what do you pay? Now, of course, if they don't go to the hospital, they didn't pay anything. Maybe they actually didn't have any medical services. Well, yes, of course, it's going to be zero. But if they've been in the hospital or they know they have some kind of copay, you know they are on the right-hand side, called the Medicare Advantage plan. So our offer to you, again, I have no idea what kind of age group we have. We could have people already on Medicare, people getting ready to turn into the 65 arena, working, not working. You know your specific situation. We will offer a no-cost consultation because we are compensated by the insurance company. We will give you the personal attention and guidance. It will either be with me, Amy, or with Kristen. We will do the consultation your way. You want to come into the office, you want to do a phone appointment. It's generally 2 appointments. Like I said, the first one, get to know each other, answer your questions, really hone in on your specific needs. And then the second one is a recommendation. And we do Zoom. Obviously, here we are with Zoom. So what we'll do for you is an analysis. You're never charged for that. We're going to use all the tools that we have available. We're going to ask you to tell us who your doctors are so we can verify it if you're interested in the Advantage plan. We're going to ask for your drugs so that we can look at what tiers they fall into and give you an idea of the cost. If you find yourself as a donut hole candidate, we're going to guide you through that. We're going to show you when it's going to become more expensive, what month, how is this all going to work? And we're always going to recommend the most cost-effective plan for you. We do a lot of listening as to what your needs really are. So again, in terms of recap, if you're in a situation of, I'm coming aboard, I want some help, we would ask that you would contact us 3 to 4 months in advance. If you want to contact us 6 months in advance, that's fine too. But at a bare bones, that would be the latest, 3 to 4. Certainly, if you want more than that, that's fine. We're willing to talk. SEP, special election period. So if you decide I'm working, I'm not doing a doggone thing with my Part A and B, my insurance with the library is fine, then we need to help you with a special election period. And I would advise that you probably contact us at least 60 days in advance, even longer, because we're going to have some forms that you're going to have to get filled out, because now the government's going to say, wait a minute, you didn't come aboard. You worked for the library. You're going to have a form that's going to go to the HR department, and they're going to say that you've had health insurance, even you're 68. So what happened between 65 and 68? You were covered. That is one of the documents that the library is going to provide. And then there's another form that we're going to fill out, and we're going to submit it to Social Security. Here's the website I made reference to. Here's our phone number. We also have an email. You've got that down at the bottom, or you can certainly ask Trish about that. And we'd be more than happy to help us. So we're coming in for a final landing. We're right on time here. Are there any questions that anyone has? I did such a good job, which is wonderful. We'll wait a few more minutes.
Nancy, I do have a question.
Okay.
If I'm on my spouse's health insurance, he still works full-time, just started receiving Social Security.
Okay.
And I think he just received a Medicare card in the mail. Do I need to go to the Medicare .gov and cancel that Medicare? Because he still has health insurance through his employer.
And does the employer have 20 or more?
Oh, yes.
Oh, yes. So your husband needs to turn the card over, and he needs to return it. And he's going to sign it. He's going to send it back, and they will take off the Part B. They will not charge him for that, and they will return a Part A only card to him. So the other thing is, with your husband being on Social Security, he cannot participate in any kind of HSA, health savings account plan. So he must stop. So he's he's got to call the HR department and say, look, I'm coming aboard with Medicare. Unfortunately, Medicare will not take the Part A back. Once they've given it to you, they look at it and say, look, it costs you nothing. We're not taking it back. But it automatically negates his ability to participate any further. So he needs to stop.
Okay. Thank you.
You're welcome. Good question. Anyone else? So if you do have any other questions, feel free to either send us the email directly, or you can certainly work through Trish. And if you want the presentation, we're going to ask that you inquire of Trish, and we'll be happy to send you the presentation. If there's any feedback that you'd say, oh, you did a really good job here, or you missed something here, or you just want to give any kind of feedback constructively, good, bad, or indifferent, we're always here looking at it in terms of trying to improve. We help a lot of different organizations. I'm an Ask the Expert for a big estate planning attorney. We get into the senior centers. We love what we do. So we want you to know that we are here, a resource at any time you have any kind of questions, whether it be about Medicare. Earlier this week, it was more about Social Security. Again, let me be a go-to resource. If I don't have an answer, I will certainly give you an answer, or just keep our firm in mind for any kind of future need you might have whatsoever. But my specialty is Medicare, so is Amy, and then I also dabble with the Social Security, as I mentioned before. Most of the time, the financial advisors get much more involved in the Social Security aspect of things, but you certainly can start with me. So without any further ado, I thank you all. There were about 10 people that participated, and again, we're a resource. Thank you for your time this afternoon, and enjoy the rest of the day. So thanks. Bye-bye.
Tune into Cornerstone Retirement Partners' full radio program, Your Course to Retirement. Visit cornerstone-rp.com for many valuable resources, including those mentioned on this show and other great episodes of Your Course to Retirement.
The content of this radio show is provided for informational purposes only and is not a solicitation or recommendation of any investment strategy. You are encouraged to seek investment, tax, or legal advice from an independent professional advisor.
Ed Slott's Elite IRA Advisor Group is solely an indication that the financial advisor has attended training provided by Ed Slott and Company, passed biannual examinations on material covered at conferences and in webinars, and met other membership requirements, and does not constitute an endorsement of any kind. Ed Slott's Elite IRA Advisor Group members pay a fee for the educational programs that allow them to be included in the Ed Slott's Elite IRA Advisor Group. Membership does not guarantee investment success. Fiduciary duty extends solely to investment advisory advice and does not extend to other activities such as insurance or broker-dealer services.
Advisory services offered through Brookstone Capital Management, a registered investment advisor.
Advisory clients are charged a quarterly fee for assets under management, while insurance products pay a commission, which may result in a conflict of interest regarding compensation.
Any investments and/or investment strategies mentioned involve risk, including the possible loss of principal. Any comments regarding safe and secure investments and guaranteed income streams refer only to fixed insurance products. They do not refer in any way to securities or investment advisory products. Annuity guarantees are based solely on the financial strength and claims-paying ability of the issuing company. Withdrawals of growth from annuities may be taxable as ordinary income in the year it is taken. Individuals should review contracts for specific details of the product's features and costs. Early withdrawals may subject the owner to penalties, fees, or taxes.